Hi everyone, bonjour from Montreal. I'm Dr. Nastya Petkova, a family dentist with 20 years of experience. Today's topic is what you should know before you start bleaching your teeth. You need to know that with the age, it's natural that our teeth become more yellow. Before you go to decide if you want to bleach your teeth, it's very important that you go for a dental checkup and for a professional dental cleaning. This will help you to know that if there is a cavity that needs to be treated before, and also that your teeth needs to be clean from the calculus which is covered your teeth. It's the same comparison if I can say about if you have a car and you want to paint it. So you go wash the car before you start to use the new paint to paint it. Also, the other thing you need to know is that in my professional advice is that you need to get prepared for your bleaching of your teeth. There is different kind of bleaching of the teeth. I'll talk about this way that you can bleach your teeth at home. So what is important to know is that all the cavities or all the fillings that needs to be replaced needs to be repaired, and the cavity needs to be treated. The second thing you need to know that when you start bleaching the teeth, it's normal that some of the teeth can become more sensitive. And my personal advice is to use a toothbrush and the toothbrush which is with a very soft bristles. And the second thing is to use the toothpaste which is for sensitive teeth, at least 2 weeks before you start your bleaching. Also, you need to consider that during your bleaching, your teeth are more sensitive to have different food to get covered from. So please pay attention when you drink coffee, when you drink, for example, wet wine or ketchup or soya. It's better to rinse your mouth with water as soon as possible, because your teeth can be very easy influenced by the color of this food or drinks. The other thing to consider is that when you're doing bleaching, you need to know that it's not a good time to change fillings, because the color of your tooth is going to evaluate. That's why in general, in dentistry, the bleaching we consider as a final step of consequence of treatments. And that's why we have now the option to choose different kind of bleaching, but you need to go carefully choose which bleaching method is more gentle and more prone for your teeth. The next thing I need to consider also that teeth have different graduation of bleaching. So, for example, front teeth bleach faster than the back teeth or side teeth, especially for the cusps, because it's very important to know that the position of the teeth determines how faster your teeth will bleach. Other thing to consider is also your genetics, because there is people who has teeth that have a very thin enamel surface and the teeth looks like transparent. So these teeth will take more time and longer to bleach than teeth that have thicker enamel surface on the top. The other thing to consider is also what is your dental hygiene, how regularly you brush your teeth. Do you skip brushing or you brush just once a day? Do you use a dental floss, a water flosser to remove the food gets stuck between the teeth? This is also thing to consider, because the food which stay between the teeth is, with the time passed on, has the tendency to color your teeth. The other thing is to consider if you smoke or not, because when you smoke, this habit also color your teeth more in a yellowish paint. And also how many coffee you take per day. This is also to consider. So yes, it's very good idea to bleach your teeth. It makes you look much younger and it makes your smile very nice and attractive. But on the other hand, you have the responsibility to respect certain requirements. so that you have a better and longer lasting result.